Well, it seems as though the information that's coming out about COVID changes daily.
It can be very confusing. Joining us now to sort out some of the questions is Dr. David Banach. He's an epidemiologist at UConn Health. I'm so excited, Doc. I said epidemiologist, and I said it right.
Thanks for inviting me on.
Oh, it's our pleasure.
All right. So, we know we've been reporting in the news that the infection rates around Connecticut have really skyrocketed. They're above 20% right now. So everyone's wondering, what do we do when this happens? First of all, do you think that's a true rate of infection when we see those numbers above 20%?
So, I think when we look at that number, I think there's a few things to think about. We know that COVID right now, there's a lot of transmission happening in the community, and that number reflects the percent of all the tests that are done that are positive. So, I think, thinking about that number, a few things to keep in mind. Those are only the tests that are performed and the data that's actually transmitted for collection. So it would exclude things like home tests that wouldn't be reported. But, I think, and that doesn't necessarily mean that, 20% of all of the population or anything like that. This is just 20% of the people who actually were tested. So, I think what it does tell us is that there is a very high level of transmission of COVID right now in Connecticut. We have to be mindful of that. And, we have to think about day-to-day activities, what we can do on an individual level to help, reduce risk and reduce spread.
All right. So if I have a sore throat or a runny nose, chances are I should probably stay home and self-test. Is that right?
Yeah, I think at this point, with so much transmission in the community, if anyone does have symptoms, and the symptoms can be pretty nonspecific, so fever, sore throat, upper respiratory nasal congestion, coughing, there's a very high likelihood that it's COVID. And I think the best course of action would be to isolate, try to go ahead and get tested to get yourself an answer before making any decisions about the next steps.
The CDC changed its quarantine rules. Schools have been sending new emails. The rules keep changing. What do you think the most important rule we need to know is right now?
So, I think some of the key points right now. So, for anyone who's symptomatic, first step is to stay home and try to get yourself tested to get yourself an answer, and really try to avoid contact with people in general, particularly high-risk individuals. If you do, go out, there are things you can do to try to protect yourself. Wearing a mask in indoor environments, this is the time to do that. And even thinking about a higher quality mask, we're sort of moving away from the cloth mask and more towards, medical grade masks, and also the even like the KN95s for added layers of protection to try to help reduce risk. And being mindful of your surroundings. This is probably not the time for group gatherings, particularly in situations where people won't be wearing masks. In order to just try to do what you can to reduce the spread and protect yourself.
How effective are the rapid tests for Omicron? I can't say that word. Variant. That's the one I'm talking about.
Omicron?
Yeah, that's the one.
So as far as the Omicron variant, the rapid tests, which are generally what we call antigen tests, they are effective in detecting this particular variant or infection with this particular variant. They're really best used for people who are symptomatic. And also important to bear in mind that sometimes they take a little bit more time to turn positive. So if at the onset of your symptoms, the initial test is negative, next steps would be either to get a PCR test, which is a much more sensitive test to detect virus, or to repeat the antigen test, typically 24, 48 hours, while still using that isolation and extra precautions during that period, with the possibility that you may have COVID and be contagious to others.
A lot of people are saying, I was around it, it was everywhere, but I got my booster shot and I never got it. I don't know if that's really protecting people, but should you get the booster shot? And remind people what the new guidelines are, because now even younger people can get it.
So absolutely. So I think what we know is that being vaccinated and particularly having a booster is really the most important thing that we can do to protect ourselves from severe infection, particularly hospitalizations and more significant illness. But having a booster can also provide protection even against milder illness. So I think vaccinations and the boosters are really key. And I think what we've seen in terms of booster access is that eligibility for boosters has increased to include some of the younger age groups. So some of the teenagers now are eligible for booster doses. There's even been some movement towards making booster doses available a little bit earlier. So moving from the 6-month eligibility, that's 6 months after completing the primary vaccine series, to 5 months, in order to really, try to help give people access to the boosters, because we know that that's really critical in preventing infection, and can also reduce the potential for transmission for people who do become infected.
Let's say you've got COVID, are there any medicines that you can take, or can you call your doctor and say I need a prescription? And are they working?
So the answer to that is yes. So, in the hospital, we've had COVID-specific medications now for many months. They've really focused on those individuals who are hospitalized with COVID, with pneumonia, requiring oxygen. But in the recent months, we've seen an expanded availability of outpatient treatments for COVID. Here, we give both monoclonal antibodies as well as the antiviral medications to those individuals who are not necessarily admitted to the hospital but have COVID. And there's a particular focus on those who have underlying medical conditions that would make them more likely to progress to more severe illness. So the idea is to give these medications early in high-risk individuals in order to prevent that progression to require hospitalization. And both the monoclonal antibodies and the antiviral therapies are really effective in doing so.
Well, as I'm sure you've heard in your past, there's no need to panic when you've got the Banach. Thank you for all of your information.